is Cassidy Richards, and I'm back. I'm going to be doing a couple things today. First, we're going to be doing a flush lock, which I would help teach the patients. And then we will move on to giving a Dilaudid 2 milligrams, and that will be in 2.5 mils, since it will be diluted with 2 mils. And then I would be giving it over 2 minutes, so you'll see that timed, and then I'll be removing the IV. So to do the flush lock, I would start by preparing, doing my 6 rights of medications. So right medication, which a flush is technically a medication, the dose, the time, the correct patient, and the right documentation. And then I will move to washing my hands, and then the first thing you will want to do is alcohol off the site. So this is where the flush lock will be at. You would lock your medication down here. So it is already locked. I did that pre. So the order has been given for only 5 mils of a saline flush. So I double check the order, double check the patient and the allergies, and then I would check the MAR once I got in with the patient. So I am going to prep my saline lock because it does lock a little bit, so you want to make sure that's prepped before you try and give it. Get the water out, not the water, get the bubbles. So I would grab it and it's lure locking, so press it and then just give 5 mils of that. And push it not super fast, slow, so it doesn't hurt the patient. Ask during if there's any pain. Check the IV site and make sure there's nothing leaking. So I have put in my 5 mils, disconnect, make sure everything looks good, which it does, and then discard of the flush. So now that that is done, I will unlock the flush and I will prepare to administer my Dilaudid push. So I will start by double checking the order and the drug, make sure that it is correct. So I have calculated 2.5 mLs. So I have my syringe here. I am going to go to 2.5 mLs. Pull that up. Maybe. Perfect. Get the bubbles out. All right. So I will disconnect my needle, and usually you would have a needle that locks. So disconnect that, and then you would insert that into here. And push that over 2 minutes. So I'm not going to actually wait the full 2 minutes, but you would push slowly like I am. And then when you're done, you would do that. And remember that there is still liquid in this lure lock portion. So you will take your second flush and get it ready. Connect it and flush another 5 ml, but you want to remember to flush it nice and slow too, over another probably minute. because this amount is still going to go into the patient, and you can hurt them by not doing it slow enough. So I'm just going to push another 5 mils. Perfect. So I will get rid of my flush and the rest of my things here. So now the next portion is to get rid of the IV. So the patient's had the IV, the potency still looks good, but it's time to take it out. So I would look at my orders, and I have a discontinue IV infusion after the last dose. So it's been the last dose, and we're ready to do that. So you will need a fresh pair of gloves. So I would wash my hands again, do my fresh pair of gloves, and I'm going to lock all of these so they don't drip while I am getting that out. So I try to be really nice and make sure I get the tape off first. So that tape went off pretty easy. And here's my Tegaderm, which is the part where you can really hurt someone. So I'm going to be nice and easy taking that off. And just like that. So now I am going to take a cotton ball, because a lot of people tend to bleed when you're doing this, and I am just going to pull it slowly out, making sure not to rip it. There we go, and it is intact. You can see there's still a bevel on it. I would wrap this hand, since it would probably be bleeding still, and wrap it with just some adhesive wrap, and we would be good to go. Get rid of your IV lines wherever is by policy. Make sure that the patient is still comfortable, and have their call light within reach. Make sure and verify and document all the procedures and how the patient handled it. Thanks. Have a great day.